Dive. Today, we're taking on a really complex and, frankly, alarming situation coming out of Minnesota. It's this massive interconnected scandal involving the alleged theft of taxpayer dollars across several critical public programs.
That's right. And our mission today is to, unpack the sources that show how these systemic failures really allowed this fraud to just proliferate. We're going to be zeroing in on the case of one provider, Smart Therapy Center, but this is about so much more than just one bad actor.
Right.
We also have to look at the very specific and often controversial service at the heart of all this billing applied behavior analysis, or ABA.
And the scale of it is why you really have to pay attention. I mean, we're not talking about isolated incidents here. The acting U.S. attorney described it as this immense web of fraud, one that has allegedly stolen, get this, billions of dollars in taxpayer money.
Billions. And that web, it connects everything. The huge established fraud in the Feeding Our Future program, the more recent housing scandal, and now autism services under the state's EIDBI program.
So it wasn't just one pool of money.
Not at all. It was opportunistic. It targeted where the money was flowing fast and, where regulation was thin.
All right, let's start with the central figure in this EIDBI scandal, Asha Farhan Hassan. She's the 28-year-old owner of Smart Therapy Center in Minneapolis, which she started back in 2019. And she's the first person charged in this specific investigation, facing multiple counts of wire fraud.
And the numbers are just shocking, even when you compare them to the other big fraud schemes. The charges state that Hassan defrauded the autism program of more than $14 million.
$14 million.
But here's where that web comes in. She was apparently double dipping, also receiving an additional $465,000 from the federal child nutrition program through Feeding Our Future.
Wait, so you're saying she was running a supposed specialized autism therapy center and at the same time a fraudulent food program?
That is exactly the allegation. And court papers suggest she used some of that money to buy real estate overseas, specifically in Kenya.
Wow, so it wasn't just theft, it was moving assets out of the country.
Right. It's a whole other level.
Okay, so how did Smart Therapy pull this off so quickly? Let's walk through the tactics from the indictment, maybe starting with how they got clients.
The indictment, it really reads like a how-to guide for fraud. The program focuses on the Somali community, which has a known high prevalence of autism, and Smart Therapy just targeted them aggressively, their main tool, cash kickbacks.
Right. The sources detail this. Parents were allegedly paid monthly cash kickbacks, something like $300 to $1,500 per child. And that amount was tied directly to the maximum services the child was authorized for, not what the child actually needed.
It just creates this completely perverse market. It turns healthcare into a transaction. The focus becomes the dollar amount, not the therapy. And it gets even worse when you see how they got those high-dollar treatment plans approved.
Yeah, the indictment says they falsified enrollment and even diagnosis details. There's a line in the legal docs that just jumped out at me. No child that Smart Therapy was not able to get qualified for autism services.
Exactly. That just screams systemic manipulation of the whole diagnostic process. They allegedly worked with these professionals to establish a medical need for the maximum hours, no matter what the reality was.
And the staff actually delivering the service.
Non-existent quality. Prosecutors said Smart Therapy hired extremely unqualified people, often 18 or 19-year-old relatives with no education past high school, no training in autism treatment at all.
So you've got unqualified staff delivering these super specialized services they aren't trained for, and then the money comes from ghost billing.
Ghost billing is the final piece of the puzzle. They'd submit claims for the absolute maximum hours, even if the kid only got a fraction of the services, or none at all. They allegedly used fraudulent signatures from providers who were out of the country or didn't even work there. It's just total fabrication.
And here's the detail that makes it feel so widespread. The indictment says parents would threaten to switch providers to get higher kickbacks from other centers.
Right. Which suggests this wasn't just Smart Therapy operating in a vacuum. It was a known, competitive method of fraud. It was operating in plain sight for way too long.
Which brings us to the big question. How was this even possible?
Well, this gets to the crucial systemic problem. Multiple sources point out that Minnesota had virtually no regulatory oversight. Why? Because the state doesn't license autism centers.
Hold on. If the state doesn't license a center, what does that actually mean? Why does that create such a vacuum?
It means that the Department of Human Services, or DHS, has no way to track basic quality. They can't see how many kids a center is serving, what the staff-to-child ratios are, or if the people doing the therapy are even qualified. If you're paying out $14 million in bills, but you don't even know if the staff are trained, The system is just broken.
And while that vacuum was there, the program just exploded. Look at this data. The number of autism therapy providers went up 700% in 5 years, from 41 in 2018 to 328 in 2023.
700%.
And the payments went up a whopping 3,000% in that same time, from about $6 million to nearly $192 million. That's not organic growth. That's a gold rush.
It's an absolute unchecked gold rush. And someone on the inside saw it happening. A former supervisor at Smart Therapy, a whistleblower, reported what she thought was negligence and fraud to the DHS Office of Inspector General.
And her quote is just heartbreaking. She wrote, "Clients aren't learning anything from this agency." She also said they were hiring relatives just to pay them less.
And here's the critical failure. The whistleblower got no follow-up. Months after contacting the OIG, nothing. The state's official line was, the volume of reports and non-public data.
Yeah.
But when you see this next to the NGA shows, feeding our future failures.
It looks like a pattern of the state failing to stop this stuff when it was still small.
Exactly.
But the tide has turned now, at least. Federal investigators found substantial evidence, which led to FBI raids on Smart Therapy in another place, Star Autism Center.
And DHS is finally ramping up. The OIG has, 84 open cases on providers now, and 24 active payment withholds. That tells you Smart Therapy was just the tip of a very, very large iceberg.
Okay, before we get into the community impact, we really need to understand the service they were supposed to be delivering. Applied Behavior Analysis, or ABA. Why is this therapy so specialized, and why is it so often controversial?
ABA is the core treatment covered by the EIDBI benefit. It's essentially a psychological method for understanding and changing behavior. It uses learning principles, like reinforcement, to help people develop new skills or replace challenging behaviors with more adaptive ones.
Can you give us a simple, kind of practical example of what that actually looks like?
Sure. A classic example would be breaking down a complex skill, like, say, brushing your teeth, into tiny little steps. That's called task analysis. Then the therapist rewards the child every time they successfully complete one of those small steps. It's very structured, it's data-driven, and it's intensive. We're talking 20 to 40 hours a week.
Okay, that explains the high billing, but it also really highlights why having unqualified staff is so dangerous. And historically, this treatment has been pretty controversial, right?
Absolutely. The roots go back to pioneers like Ivar Lovaas in the 1960s. His early work showed the therapy could be effective, but it also notoriously included the use of aversives, things like slaps or even mild electric shocks.
Wow.
Yeah. Now, those practices are condemned and banned by modern professional groups, but the ghost of that early history still fuels a lot of the criticism today.
And a lot of that criticism now comes from the neurodiversity movement. What's their main argument against modern ABA?
It's a pretty profound critique. The movement argues that when ABA focuses on normalization, it's really trying to force autistic people to suppress or mask their natural autistic traits. Things like stimming or avoiding eye contact just to appear more neurotypical.
What exactly is masking, and why is that considered harmful?
Masking is basically hiding your authentic self to fit in. Many autistic adults who had intensive ABA as kids report that this constant effort, this self-monitoring, is linked to chronic stress, burnout, and really poor mental health long-term. Some even say it contributes to symptoms of PTSD. Their argument is that harmless autistic traits should be accepted, not, extinguished.
So you've got the medical establishment on one side, citing ABA as evidence-based for developing life skills. And on the other, you have autistic voices saying that bad or rigid ABA can cause lasting psychological harm.
Precisely. And that's why this Smart Therapy case is so devastating. When you have providers hiring untrained 18-year-olds, paying kickbacks and ghost billing, you're not just stealing millions, you're potentially subjecting vulnerable kids to a therapy delivered so poorly that it could do more harm than good, all while cashing in on a technique that already faces serious ethical questions.
Let's talk about the community that was really victimized here. Somali children in Minnesota have a really high prevalence of autism spectrum disorder. It's 1 in 16 for 4-year-olds, which is much higher than the state average of 1 in 53. That's a huge legitimate demand for services.
It's an extreme need. And our sources say that before minority providers got into this field, Somali autism moms faced incredibly long wait lists. They felt kind of marginalized by the existing system. The minority providers stepped in to fill that gap.
But that vacuum and the flood of cash led directly to these really sketchy operations. We found a report from an early childhood teacher who saw these autism centers popping up in crazy business parks. She saw very few learning materials and young staff just glued to their phones. It sounded more like a poorly run daycare than a clinic.
And the tragedy is that some parents didn't even know what to expect. The teacher noted that many immigrant parents thought their kids were just getting free child care for 20 hours a week, not intensive ABA therapy. They were just so vulnerable to exploitation.
There is also a critical counter perspective from inside the community. Advocates like Idil Abdul argue that DHS needs to do more than just prosecute. They need to educate communities on the rules. They also suggest DHS may have been quicker to target minority agencies for small mistakes than non-minority ones, implying a potential bias.
What's really clear is that the legitimate providers are just desperate for change. The Minnesota Autism Center, MSC, for instance, is pushing hard for stronger oversight and licensing. They point out that they're nationally accredited, they employ over 120 licensed professionals, and have all these quality control protocols.
And MSC says the legitimate need is just soaring. They reported a wait list of over 550 children, which just illustrates the cruel irony here. While good quality centers are overwhelmed, these bad actors were stealing millions meant for those 550 kids and thousands of others.
Yeah, and the failures have finally spurred some legislative action. Minnesota has passed new measures to try and close those regulatory gaps we were talking about.
Let's unpack the big one, licensing. Starting in January 2026, Minnesota is establishing provisional licensing for these EIDBI programs. How does that fix the no oversight problem?
Well, it's a huge shift. Provisional licensing means the state has to vet these centers before they can start billing. It lets DHS proactively track staffing, caseloads, and investigate maltreatment from the start. It replaces the old system of just reacting after a fraudulent bill comes in.
They also went right after the kickback problem, which was the engine for Smart Therapy's recruitment. A new state law makes it explicitly illegal to pay clients to participate in Medicaid or other programs.
Right. It aligns state law with federal standards and gives prosecutors another tool. And, crucially, they're tightening surveillance. The Medicaid revalidation cycle is shorter now, from 5 years to 3. Stricter background checks, too.
And maybe the most powerful tool is this. The state can now ban individuals under fraud investigation from owning or managing any human services program. So if you get caught defrauding the food program, you can't just close up shop and open a fraudulent autism center.
These steps are critical. They're a formal admission of what the acting U.S. attorney said. The old system of just trusting providers no longer works. The new system has to be built with deterrence and oversight baked in from the very beginning.
So if we synthesize this whole deep dive for you, the fraud really happened at this dangerous intersection. You had massive government funding, a critical high-demand service like autism therapy, and just a profound, long-standing regulatory vacuum.
The acting U.S. attorney called it an immense challenge, and it really highlights a massive societal betrayal. When fraud like this takes over, the faith that our tax dollars are helping the vulnerable just collapses. And this theft hurt Minnesota taxpayers, sure, but it most acutely hurt the children and families who needed that quality care the most.
So here's the provocative question we want to leave you with. This situation shows a government that was desperately trying to expand rapid, equitable access to specialized services for a vulnerable population. But in trying to meet that need so quickly, they created a regulatory vacuum that bad actors exploited for immense criminal gain. How do states ensure that kind of rapid, equitable access without, inadvertently creating the very gaps that organized crime will always rush in to fill? It's the ultimate tightrope walk between efficiency and integrity in modern public service.